Yeah, so the ZUMA-5 is a Phase II multi-center single-arm study where we evaluated Axicabtagene Ciloleucel, which is an autologous anti-CD19 CAR T-cell therapy in patients with relapsed or refractory indolent non-Hodgkin lymphoma. To be eligible for this study, the patients had to have either follicular lymphoma grade 1 to 3A or marginal zone lymphoma, either nodal or extranodal disease. And they had to have at least 2 prior lines of therapy, including an anti-CD20 antibody and an alkylating agent. And once the patients underwent leukapheresis and the product has been generated, they received standard Cy/Flu conditioning chemotherapy followed by a single infusion of CAR T-cell therapy at a dose of 2 million CAR positive cells per kilogram body weight. And the primary endpoint for the study was overall response rate as assessed by independent radiological review. Last year at ASH, we presented the primary analysis on the study where patients have had at least 1 year of follow-up. So here we are presenting the longer-term follow-up with where follicular lymphoma patients had a minimum of 2 years of follow-up. And we observed now in the follicular lymphoma cohort, the best overall response rate was 94% and the complete response rate was 79%. And for the marginal zone lymphoma cohort, the best overall response rate was 83% and the complete response rate was 63%. In the follicular lymphoma cohort, the median follow-up now is 31 months, and the estimated median PFS is almost 40 months, and 57% of the patients remain in remission as of the data cutoff. In the marginal zone lymphoma patients, the median follow-up is 24 months, and 50% of the patients are still in remission as of the data cutoff. The therapy was quite well tolerated. The most common adverse events related to CAR T-cell therapy were cytokine release syndrome and neurological events, but most of these were grade 1 and grade 2. Grade 3 or higher CRS was observed in 7% of the patients, and grade 3 or higher neurological events were observed in 19% of the patients. The therapy appeared to be better tolerated in the follicular lymphoma cohort, where the neurological events were only 15% compared to marginal zone lymphoma patients where the grade 3 or higher neurological events were 36%. But overall, most of the CRS and neurological events resolved as of the data cutoff.